everybody, welcome to Better Health Together, and today we're talking about depression and the fact it looks different for everybody. With me I have Dr. Danny Rock, who's our resident expert on all things mental health. Just briefly, Danny, can you, in introducing the topic of depression, can you talk about depression prevalence and across the life course, and just very briefly, how that looks to a community member?
Okay. I think one of the problems with depression really is the word depression itself, because we use it in a general sense to feel low, depressed. And then depression as a medical condition is something quite different. It's not simply an extension of just not feeling good with yourself. It's very characteristic. So it has certain symptoms and presentations but when you look at it, it's a disorder.
Right.
It might be a mild disorder, but it's a disorder in the same way as catching a cold is a condition. And then it progresses. The illness can come in different forms. It can come in a mild form, like in a mild cold, right up to very severe depression where people are bedbound.
Danny, can you tell us about our approach to depression and the Alliance Against Depression?
The Alliance Against Depression is really centred on an individual and their general practitioner. And the way I think of it, interestingly, the way it's described in Germany where it originated, the German teams would call it enhanced step care. So basically, what you're looking at is one of the pillars is increasing the capacity and capability of general practice to manage, recognise depression, and particularly type depression, melancholic and non-melancholic, and manage it effectively. How that's done is in a community context. It's about awareness at the local level. So we have all these campaigns about awareness at the national level, but knowing what it is, who are the high risk groups in your community, what are the issues in your community. The issues in Collie are quite different, I would think, than the issues in Albany, which are quite different from the issues in Rockingham. So that understanding the local context and having a campaign that is localised around that. That's the other pillar. That's one of the other pillars. Again, related to that is identification of high risk groups. It's not high risk groups in the main. It's high risk groups in the place.
Yes, in the location, in the community.
In that location. And you won't know who that is until you go and look or go and talk to the local community. So it might be the Maori community near Rockingham. They wouldn't be a high risk group for the whole of Western Australia. And the other element is having community gatekeepers, individuals in the community or members of the community who can recognise when someone isn't doing so well and maybe point them in the direction of primary care. This is a model that you work with the community to enhance their capacity to manage it themselves.
Yes.
You use the community structures, and that means it won't work in every place.
No.
This is not a panacea. This will work in places where there is community engagement, where there are communities who are enabled to respond. Work around a sports club in a country town. But you do need those basic fabric of community cohesion to work on.
We're about to launch a campaign. Well, in fact, it's live now, titled Depression Looks Different for Everybody. And the campaign has 4 real live stories, people telling their own story, with the aim to help people understand actually what is depression, and to reiterate that getting help isn't that hard, but also importantly, it's very effective. So can I ask you to go to our website, take some time, watch those wonderful videos, and also share them, because in sharing them, you'll never know who of your friends and colleagues might also want to share that with others. So thanks again for your time. Thank you, Danny, and we'll talk again soon. Bye for now.